Good morning, everyone. I'm here to give you a lecture demonstration on how you're going to introduce or insert IV solution, intravenous solution to our patient. So the first thing that you should do is to get an desired IV solution, intravenous solution to our patient. And then, next is you get all the things that you need. You prepare first the set before going to your patient's bedside. And then, when you get the IV fluid solution, you have to write the name of your patient and the specific IV solution that you're going to use for his case. And then you put the IV tag on the IV of the patient with his name and the specific solution and the number of drops that you need to give to your patient per minute. Now, we are ready to prepare our set. We have here the difference between the two sets. We have here the macro set. The difference is there's no needle here, and the micro set there is. Okay, this one is the macro set. This one is the micro set. These two sets delivers different number of drops. No? It depends, of course, on the desired drops that you need to prepare. So we will use this micro set. Okay, so this one, we will prepare this first. We open this and then, okay, prepare it. Wash your hands. And then, you have here the set. Okay, this one is the tubing. This one is the chamber. And then you have the control here. Okay, open and close. And then this one is the lower lock that you need to attach later in our set. Okay, now next step, we are going to open our IV bottle. Open it. And you start to spike our IV bottle. Okay, that's it. But before you turn it over here, you have to make sure that the control here is still locked. Okay, lock this one so that when you turn this over, there would be no fluid that will accumulate on the chamber. Otherwise, if it accumulates here in the chamber but it's not yet full, partially filled out, then air will also join and it will come in here our tubing. So we'll put this one, hang it on our pole. Okay. Now we can open this. Okay, kink this tube here first and then open the chamber. We will partially fill the chamber with fluid. Push this one to fill this fluid here, the chamber. Now you have partially filled up the chamber and you are going to open the control here. Okay? And then you can open this lower lock here and then introduce little by little your fluid so that the tubing will have it will be filled with the fluid here and it will not be air that is filling the fluid. Okay? Okay, filling the tube with fluid. We don't want air to accumulate on our tubing. Once it's out, then you can lock this one. You see, what is very important is that we will fill this up with fluid first before we start inserting our IV to our patients. We don't want air to fill this tubings because we don't want to have air embolism, or that is usually the risk of introducing air to the system of our patient. So now we will start. Since we have already prepared our IV tubing, we will get our venipuncture set. If you don't have the venipuncture set in the ward, you can prepare your cotton ball with alcohol, cotton ball with betadine solution, your cannula. We have different sizes of the cannula, but what we are going to use this time is a gauge 22, which is the blue one. It is indicated for adult patients. You have to prepare your micropore and your splint, and then your scissor. When you prepare your micropore, prepare it first. Okay, hang it on your tray. You prepare one with a butterfly cut here at the center. So this one will work as an anchor later. Okay, like this. Cut it at the center. And then another micropore. Prepare at least 4 or 5 cuts of micropore. Now you're ready to get and prepare your patients. Okay, first thing that you will do is to prime the hand of your patient. Check which vein you want to use as dorsal as possible. So with cotton ball, alcoholized cotton ball, we will prepare in a circular motion going outward. Another one. Cotton ball with alcohol from the center going outward. Okay. Let it dry. And then Get your venipuncture kit and wear your glove. You don't want to come in contact with the blood of our patients. This is to protect yourself. Okay? And then, put a tourniquet to have a very good or a visible vein of the patient. Okay? We have here the vein of the patient. Prepare your cannula. You have the wings here. And then try to open this is going to be the flashback chamber where you should see a flashback of blood if you are already in. Okay, and then the needle is inside the cannula. Okay, so how are you going to hold this one? Okay, so you will see the flashback of blood. And then you push your cannula inside, holding this one, the needle. Okay. Okay, and then get your butterfly. Straight first to hold the cannula in place. And then this one. Okay, so that's the end of our, and then release the tourniquet and then put the arm rest or the splint. Okay, splint it like that. Okay, and then connect your tube to the lower lock. And then we remove the needle. Hold this portion here. Remove the needle. And then put your lower lock, your IV tube in place. And then adjust the drop, okay, and then make sure that it is attached to the skin of the patient, okay, so that it will not be moved at any time. That's it.